Okay, so today we're going to do a brief overview of diabetes. Now, diabetes is a broad topic, okay? It can take a long time for it to be properly dissected, but we're just going to do a really short overview of diabetes. Now, when you think of diabetes, you're thinking about a metabolic disorder, right? And this is caused from a defect in either insulin secretion, insulin action, or both. Now, the category of diabetes is type 1, type 2, or there is gestational diabetes. Now, when you think of type 1 diabetes, this is due to the autoimmune beta cell destruction. And so this will lead to insulin deficiency. When you think of type 2 diabetes, you're thinking of a progressive loss of that beta cell insulin secretion, and this now will cause insulin resistance. Now, when you're thinking of gestational diabetes, it is being diagnosed during pregnancy, and this is usually along the second or third trimester. Now, there are other specific types of diabetes, okay? And these are called monogenic diabetic syndrome. That's like a broad umbrella. And so things fall underneath this umbrella. For example, neonatal diabetic and maturity onset diabetes. And these are children, diabetes in children. Okay. There's another type under this umbrella that is called disease of the endocrine pancreas. And so this is called from different diseases, like, for example, cystic fibrosis. What about drug and chemical induced diabetes? Okay, some drugs causes an increase in your blood sugar, which can diagnose you with diabetes. For example, steroid family, glucocorticoids, right? Steroid family, or treatment for HIV and AIDS, right? Or treatment that are being used after an organ transplant. Okay. All right. So again, when you're looking at diabetes, it is really, really broad, but we want to just look at the cause, the effect, and what are some of the damages that it causes. Okay. Now, the test that we will use to diagnose diabetes is called hemoglobin A1c. That is the most accurate test that will be used. Hemoglobin A1c is just a blood test that measures your blood sugar level over a period of time, over 3 months. Okay? Now, when your sugar enters your body, or when sugar enters your bloodstream through juice or food, okay, it attaches to hemoglobin. And hemoglobin is a protein in the red blood cell, that is carried in your bloodstream, in your body. Now, everyone has some level of sugar that is attached to that hemoglobin. But there are some people that has a higher amount of sugar that is attached. And so you will see it showing up in your blood in that test, in that hemoglobin A1c test. It looks that entire period in 3 months, how have that blood sugar been? How high has that blood sugar been? And so that is the hemoglobin A1c test. There are other tests that you can use to diagnose blood sugar. Fasting plasma glucose, casual plasma glucose, and of course, oral tolerance test. Okay. All right. So in type 1 diabetes, there are signs and symptoms that you're going to see. If you've never been diagnosed with diabetes, but you know that something is wrong, there are things that your body is going to start to do that it has never done, and will let you know that, look, pay attention. Okay. So we call it the 3 Ps. So polyuria, polydipsia, polyphagia. So polyuria, when you see the word poly, it means excessive or a lot. So polyuria means excessive urination, increased urination. You're going to the bathroom all the time. This has never happened before. You realize that it's new, it's strange. Polydipsia means excessive thirst. You're thirsty all the time. You want something to drink. You're just not getting your thirst under control, right? The more you drink, the more thirsty you feel. You know that, again, that's not normal. Polyphagia means excessive hunger. You're eating all the time, you're snacking all the time, you're still very hungry. There are other signs and symptoms that you can see. We just look at the main ones: polyuria, polyphagia, polydipsia. But there's weight loss, fatigue, change in level of consciousness, which just means confusion, increased infection, whether it's urinary tract infection or yeast infection. What about poor wound healing? Okay, itching of the skin, dry, scaly skin. There are other signs and symptoms that can tell you that something is definitely wrong. Okay. All right. In type 2 diabetes, again, insulin resistance, it can be caused by either genetic factor, that means it's passed down, or it can be caused by environmental factor. And the environmental factor means something that we have done ourselves to cause this. So, for example, sedentary lifestyle. What does that mean? Sitting around, eating unhealthy food, long hours watching TV, not moving, not being active, okay? Eating the wrong things. Your age is also a risk factor. If you're over 50 years old, then you have a higher risk of developing diabetes. If you have chronic illness, back pain, joint pain, and it's, hampering your mobility, that can also cause diabetes, okay? And of course, obesity, big one. If you're overweight, it's going to pressure your pancreas. Eventually, your pancreas is not going to hold up with the pressure that is being put on it. So then what are the symptoms of hypoglycemia? If your blood sugar drops below 70, your blood sugar needs to be between 70 and 100. If it drops below 70, it's hypoglycemia. Hypo, low. Remember that? So if it's hypo, you're going to have fatigue. You're going to feel very hungry. You're going to be shaking, sweating, irritable. Your heart rate is going to increase to compensate. Okay? You're not going to be able to concentrate on anything. Okay? If your blood sugar is too high, it's way over 100. It's in the 200s, 300s, 400. It can go even up to 600. Okay, you go into other things like diabetic ketoacidosis, or another one is HHN. Okay, and that we'll get into later. But you'll start to see, the sweating. You'll start to see pain, abdominal pain. If you're thinking about diabetic ketoacidosis, you're talking about the fruity breath, because your system is burning off ketones. It's going into fat. Okay, so damages can be done. If you're diabetic, there's going to be damage to all your major organs: your eyes, your kidneys, your nervous system, your brain, your heart, and your extremities. Okay, so we have to take care of ourselves. We have to make sure that we watch our intake, that we go out, exercise, eat right, and follow up with our doctors if we see any of the signs and symptoms that we're discussing here today.